Your surgeon has mentioned hip resurfacing. Here's what that actually means and how it differs from a full hip replacement. The hip is a ball and socket joint. When cartilage wears away, the bones rub together, causing pain and stiffness. In a total hip replacement, the entire ball of the femur is removed and replaced with a stem and new ball. In resurfacing, the femoral head is kept and capped with a smooth metal cover like a crown on a tooth. Resurfacing is generally considered for younger, active adults with strong bones and larger hips, most often men. Doctors typically consider resurfacing after non-surgical treatments. Physiotherapy, weight management, medication no longer control the pain. During surgery, the hip is opened, the ball is trimmed and shaped, and a metal cap is fixed over the preserved bone. A metal cup is press-fitted into the socket. The capped ball then moves smoothly inside it, restoring the joint. Most patients stand and take a few steps with support the same day or the morning after surgery. Over the following weeks, patients move from crutches to a cane, then walk unaided, guided by physiotherapy. Full recovery, including hiking, cycling, golf, or doubles tennis, usually takes 6 months to a year. Risks include infection, blood clots, femoral neck fracture, and metal ion release from the bearing surfaces. Because metal-on-metal implants release small amounts of ions, long-term follow-up with X-rays and blood tests is important. If a resurfacing ever fails, it can usually be converted to a standard total hip replacement. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.